Good afternoon, everyone, and welcome. Thank you for joining us. I'm Zoe Thompson, Head of Insurance Fraud at 9 St John Street Chambers, and today I am joined by three of my colleagues, Jamie Hill, Brian McCluggage, and Chris Kennedy. And we will be presenting you today with three different talks, all on the subject of fraud in catastrophic injury claims. So it's going to be Jamie and I first, then Brian, then Chris. So if I could just ask Chris and Brian maybe to turn off their videos for this part, and Jamie, I'm going to hand over to you to do the introductions to our talk.
Thank you very much, Zoe. I'm just going to share my screen now so the presentation comes up onto the slide. This comes up. Lovely. All right. So this is the talk that Zoe and I are going to be giving today. It is, as you can see, about faking catastrophic injury. And we have got a number of different conditions to go through today. So there's FND, functional neurological disorder, CRPS, complex regional pain syndrome, and we've got PVT, that's performance validity testing in the context of brain injury cases. The agenda, which is being shared with you now, shows what we're going to go through. So we're going to look at those three conditions, and also we're going to, forgive me, there we go. We're going to look at those three conditions, look at what they are, what the diagnostic criteria is for them. Importantly for today's purposes, how they can be faked, or how a claimant who's malingering may appear when presenting with those conditions. And we're going to look at some case study and case law examples. So starting with FND, we've got the DSM-5 diagnostic criteria on the screen now. Firstly, I'll just say, what is FND? It's often referred to or described as a brain network disorder. That is to say that there is no organic disease affecting the brain, but the brain is not functioning or is not appearing to function normally or correctly. So one might think of it like a computer. If the brain's a computer, the computer's not working properly, but you have a look at the hardware and there's no obvious fault with anything. So it's a functional problem, not an organic problem. There's no pathological changes, for example. There are a number of symptoms that a claimant may present with FND. For example, limb weakness or non-epileptic seizures. There may be speech difficulties or tremors, and you can see that shown on the slide now. So motor or sensory function is category A. B, clinical findings provide positive evidence of incompatibility with a recognized neurological or medical disease. C, you can see what's said there, symptom or deficit not better explained by some other disorder, and the symptoms cause significant distress. It's been within DSM since about the 1980s, since the third edition of DSM. It's referred to in DSM as a conversion disorder. Its inclusion within DSM isn't without controversy, but it is in there and has been for 40 years or more. Importantly, FND is not a diagnosis of exclusion. So even though on the previous slide we saw, for example, at C, it said not better explained by another medical disorder, that's not to say that it's a diagnosis of exclusion. In fact, it is not. And a diagnosis of FND should only be made where there are positive findings. And it is interesting to observe that the current version of DSM-5, cautions practitioners that internal inconsistency at examination is a way to demonstrate incompatibility with a diagnosis, and in fact lists malingering as a differential diagnosis. So practitioners need to look out for, when diagnosing this condition, positive signs. And on the screen here, we've got some of the positive signs that may be seen. So, for example, the weakness that's shown on the first bullet point that's characteristic of FND, a positive Hoover's sign, for example, so an examination of the hips while the patient's lying down on their back, a gait disorder, or the seizures that are typical with FND. That's what FND is. That's how it's diagnosed. Now we're going to turn to how it is faked. And it will be clear from what I've said, it's not an organic disease. There's no identifiable pathology. That this is a condition capable of being feigned, because there's no objective verification for it, albeit there are the tests that we've just looked at and the clinical signs that one would expect to see. The problem is that the diagnosis depends very significantly upon a patient's reporting. The other big difficulty is there is no difference between the physical findings on examination, so a clinical examination by a doctor, of someone who genuinely has FND and someone who is feigning. So, for example, I mentioned a positive Hoover's sign on the previous slide. That is what you would expect to find in someone with genuine FND, but it is also what you would expect to find if someone was malingering. And the same with the seizures and an altered gait, for example. Those are things that can be feigned by somebody. And even in NHS practice, it's widely considered that these symptoms can be feigned, although it's quite rare. But of course, in medical legal settings, the incidence of them being feigned is much greater. When looking at trying to establish whether someone is faking this condition, given we can't look for an objective test, given that the clinical findings will often be the same whether the person is genuine or not, the obvious question is, well, what can we do to try and catch somebody out? And on the next slide, Zoe is going to discuss a case study of hers. So without trespassing onto her territory, in general terms, I've put a few slides on a few bullet points, forgive me, on the slide here. Really, what we are looking out for is somebody doing something that they say they cannot do at all. That is far better evidence of someone who's faking FND than simply somebody who says that, for example, they can't do something very quickly, and then you see that they can do it quickly, because as it says on the screen, less weight should be put on those types of discrepancies, because that can well occur even in people who are not malingering. But I won't say any more about that, because Zoe's got an excellent case study. So Zoe, over to you.
Thanks, Jamie. So this is a case which I had, which discontinued about a month ago now. What you will find is FND is a relatively new phenomenon. in the world of catastrophic injury. So you won't find, as much as you might try, any good reported cases where there's been an FND case where someone has been found to be fundamentally dishonest. So this is as good as you're going to get. The case of CS started out, when it came to me, as a case where everyone had diagnosed the claimant as having FND. And that included the defendant's two instructed experts, Professor Stone and Professor Carson, who, if you're familiar with this area, you will know that they are two of the leading authorities in the country on FND. And they had both been hoodwinked, we can say with the benefit of hindsight, into believing that this particular individual had FND. And off the back of them making that FND diagnosis, the defendant had also made a substantial Part 36 offer, so a claim pleaded at close to £1 million, and they'd offered close to £200 just off the back of the first set of medical reports. The reason they made that diagnosis was because the claimant was spot on in terms of his presentation. He had findings typical of the condition. They had both considered the possibility, as Jamie mentioned, of malingering, but had basically said they couldn't find any evidence of any willful exaggeration. So we were looking at a substantial value claim because the claimant, he was a chef, he'd been able to go back to working a couple of hours part-time a week, and he had a substantial ongoing care claim as well, as he was in his 40s, had 2 children to look after and a wife. One of the key reported symptoms he had was this unusual gait. And he reported that this unusual gait, which basically left him walking in an almost robot or Frankenstein-like manner, meant that it would take him something in the region of 25 minutes to undertake a journey that would normally take him 5 minutes. So this gait meant he could only walk really slowly. So that was his main reported symptoms, which the experts thought that's spot on with what FND is. And he also reported seizures. And when he did have these seizures, fortunately, his wife was on hand to video them. So he was able to get video of these seizures, which he was then able to pass on to the medical experts to consider, again, as one of the more familiar symptoms associated with FND. So if you don't mind, next slide, please, Jamie. So having made this initial diagnosis, the defendant's experts then withdrew the FND diagnosis after considering some surveillance and some other evidence. And the principal evidence in this case was a discrepancy in gait seen on surveillance compared to what the claimant had described. Now, I have to pause here to say, to basically reiterate 2 points that Jamie's already made about why it is going to be so hard to do what we did in this case and actually get good surveillance on an FND case. So the 2 reasons are FND is characterized by symptoms that wax and wane. So it is ripe for a good days, bad days defense if you do end up getting your surveillance. And the other key feature, again, that Jamie mentioned is that patients with FND do routinely over-report their symptoms. So part of the condition is a perception that things are much more constant than they are. So listening to that, you probably want to know what was so good about the surveillance in this case. So the first point is at the quality of the surveillance. So we basically had the claimant out walking, and we were able to measure by way of the distance, and this was all confirmed in statements from our surveillance operatives, exactly how far he had walked. So you could measure his walking speed against what he had described. He was also seen on these various walks out because he was walking his dog, he was collecting dog poo, he was bending on multiple occasions, and one of the specific symptoms he had described to the medical experts was that he could not bend. But where it got better for us was that we had this surveillance evidence on the same day that the claimant attended our examination with two of our experts, so Professor Stone and our orthopedic expert, Mr. Getty. So it was same day surveillance footage. Jamie, can you go on to the next slide, please? Not only that, two of these three medico-legal examinations included video interviews. So the experts, again, Getty and Stone, had undertaken a video examination where the claimant was shown demonstrating this abnormal gait. And it was a good 3 or 4 minutes long. It had the claimant walking around in the examination room, literally showing the experts what this bad gait was that he was describing. Not only that, you could hear the experts in this video asking the claimant the question, do you walk like that all the time? Or is that just today? Do you have good days and bad days? The claimant explicitly confirming, no, I walk like this all the time. In fact, one of the experts said to him, are you sure about that? Because you've been sitting down for an hour while I've interviewed you. Is this not just as a result of you getting up? And he said, no, it's like this all the time. And his wife was there and she was nodding along with this, saying, yes, this is how he walks all the time. What we also had was a witness statement from the claimant in which he admitted that he had deliberately deceived the expert witnesses about how far he could drive and a holiday that he'd taken in Australia. And you might ask yourself, why on earth would the claimant admit to those things in a witness statement? And the short answer to that, we think, is because we had withdrawn the Part 36 offer after we obtained the surveillance evidence. And so the claimant will probably have been asked by his solicitors, well, have you told some untruths to the medical experts or something like that? And it was off the back of that the claimant said, I said I hadn't been on any holidays, but that was a lie. My wife told me to say that because she thought it wouldn't look good. I also lied about my ability to drive because my wife thought it wouldn't look good. So he'd admitted to misleading these medical experts. So we had to sit on that surveillance for a year. So we had it, and we had to wait for the second round of medical reports. We had to wait for the pain management experts to be instructed, and we had to wait for the claimant to serve his witness evidence. But when we did get all of that in, then within a month, the claimant had discontinued his claim. So I think that's probably as good an example as you're going to get about the type of evidence that you need to win on an FND case. But I think for me, one of the big points here is that the experts were all hoodwinked by the claimant, including the defendant's experts, into believing that this individual had FND because he was so convincing and he got the symptoms so spot on. Right, Jamie, next one for you.
Thank you, Zoe. So that's FND. We're now going to look at CRPS. That's a complex regional pain syndrome, which is a type of chronic pain syndrome. This is a pain condition which would be normally expected to materialize after injury or surgery, but leave the patient with more severe or longer lasting pain or symptoms than would otherwise be expected. Often patients will complain of pain which they describe as burning, stabbing, or stinging, and there are often associated changes to the skin, hair, or nails. On the next slide, we've got the diagnostic criteria, the Budapest Clinical Diagnostic Criteria, which is the generally accepted criteria that is used, and it is in 4 parts. The first 2 are on the screen. So number 1 is essentially what I've just said, continuing pain after normally injury or surgery which is disproportionate to the inciting event. Number 2 is the symptoms that the claimant must report. So that's what they must say they have, and you've got them on the screen there. There are a number of different examples of things that you may see. So, for example, sensory symptoms, often being sensitive, for example, to light touch or pinprick testing. Motor, there's motor changes. So often in these types of cases, claimants will say they have decreased range of motion. For example, sweating asymmetry is another common feature, as is swelling and also temperature or skin color changes. But you can see on the screen for yourselves what the full criteria is for what the claimant must report. Number 3 of the criteria is the signs that the claimant must display. So this is intended to import some rigor into the diagnosis, because it's not just what they must say, it's what must be clinically observable. But here it's in terms of the criteria that they must display, it's 2 or more of the 4 subcategories rather than 3 or more is what they must state they have. What they must actually display is slightly less. And again, you've got the same sort of things there. Some of the things that may be tested for example, pinprick testing that I mentioned, or soft tissue massage, etc., etc. Again, it's there on the screen. You can see what is said for criteria number 3. And then for number 4, and this is potentially the key point, is that there's no other diagnosis that better suits or explains the signs or symptoms. So this is a diagnosis of exclusion, and you would therefore normally expect other conditions to have been ruled out. So clinically, you might expect, before diagnosing CRPS, to have undertaken blood tests, for example, to look at potential rheumatological markers, to have had the patient undergo imaging, perhaps so radiological imaging to look at the bones, perhaps nerve conduction studies to check that there's nothing wrong with the nerves, so on and so forth. So, how may CRPS be faked? Well, the first thing to say is the diagnostic criteria is widely available online in much the same way as it is for FND. So anybody can find out what they need to qualify for a diagnosis if they have access to the internet, which in reality is the overwhelming majority of people. Criteria number 1, you just have to say that you continue to have pain, and criteria number 2, you just have to say you're continuing to have those symptoms. Category number 3 is supposed to import objective testing because these are signs that should be observable by the clinician before a diagnosis is made. However, many of those things can be feigned. So, for example, motor dysfunction, restriction in range of movement, can be easily faked by a claimant. Skin changes can be caused by deliberate injury or disuse of the arm, and sensory abnormalities can just be subjectively reported to be painful or unusual. And there is a school of thought amongst some experts that where a patient's veracity is in doubt, very limited credence should be given to those signs that can be mimicked or induced. But other experts don't have that view. And we're now going to move on to a case study, again, another of Zoe's cases, in which a claimant who satisfied the Budapest criteria and had symptoms that were observable clinically turned out, as we might find out, not to actually have CRPS. So Zoe, over to you.
Thanks, Jamie. So this is another discontinuance case where claimant in a substantial value case is discontinued once all of the evidence came to light. Important, going to give you a heads up now that this is a case where we had no surveillance and no social media, but we were still able to succeed on the basis of what we thought was an FD case. So the claimant in this case injures her right elbow in an accident at work, and initially the medical evidence was all pointing towards a very minor soft tissue injury that's going to resolve within 6 months. But claimant was saying that her symptoms had worsened, and she claimed that she was effectively a one-armed lady, so she had lost all effective use of her dominant right hand. She was not able to use that right arm at all. She was not able to continue her job in a factory, and she required substantial amounts of care and assistance. And her case was supported by an expert report from a pain consultant who, having gone through, as Jamie says, all of these possible diagnoses, was unable to offer anything other than CRPS. So it was basically the claimant's reporting and signs that were all capable of being mimicked or induced. So this is a case where the claimant did not have any of those obvious physical features like the brittle nails or the hair growth. Next slide, please. So for the defendant, we had Professor Davies, orthopaedic, and we had Dr. Miller, pain. So this was actually after that case in which Dr. Miller got a bit of a telling off for the court for going down the exaggeration route, but he was happy to do it in this case because he had Professor Davies backing him up. And they both opined that the claimant didn't have CRPS. So they'd taken the view that this was an issue, both an orthopedic issue as well as a pain issue, and neither of them thought she had CRPS. And the two main points initially were that her onset was a year post-accident, whereas there was literature which all said CRPS, you usually get it within a month or a few months at most. And secondly, the claimant was describing intermittent and variable symptoms. And with CRPS, usually what you get is unremitting pain, hence it being a chronic pain condition, although you can get flare-ups. So that was a pretty good start for us, but in the context that the claimant was saying, nobody's really understood me. English wasn't her first language. And so she was suggesting that some of the entries in the medical records were incomplete. And she was also saying that she had mental health problems. Although in her witness evidence, she maintained this account of intermittent and variable symptoms. So that was a statement before either of these two experts had offered their initial opinions. Next slide, please, Jamie. She also relied upon the presence of intermittent swelling. And unusually, when she went to see the claimants, her own experts, they noted this intermittent swelling and they took photographs of it. But when she went to see the defendant's experts, she didn't have any of this swelling. So in addition to the orthopedic and the pain experts, we also had psychiatrists instructed on this case. But she did have photographs showing the swelling and the bruising, which she said appeared every 6 weeks and lasted for a couple of weeks. So she had a series of photographs. And then obviously there were the photographs that were produced by her own experts at the medico-legal examinations when they had noted the swelling. My experts said that this transient swelling was not something they had ever seen and was not consistent with CRPS. However, they went further than that, and both of them offered a positive opinion that these were self-inflicted injuries caused by the claimant. And they went through this series of photographs and were able to say, well, this one, we think what she's done is she's hit her elbow on a tabletop. This one, we think she's created a small wound. I think it was through using a kebab stick. This one looks like she's put her arm on a hot radiator. That's a radiator burn. Next slide, please. we got as far as the joint statement stage. So the claimant's expert continued to support the diagnosis of CRPS, but notably in the joint statement, he didn't address head on this issue that our experts had identified with what they thought were self-inflicted wounds. Next slide, please. One of the key things here is that although the claimant had a psychiatrist, I think it was Dr. Whittington, who diagnosed her with some anxiety and some depression, the psychiatrist didn't support any differential diagnosis of somatoform disorder. Neither did my psychiatrist. And so what that meant is that the court was presented effectively with a binary choice, because CRPS was the one and only explanation that was being proffered on behalf of the claimant for her symptoms. And our contra diagnosis was effectively that she was lying, that this was fundamental dishonesty. So claimant discontinued a week before the trial. And it, for me, is a really good example of a case where we didn't need social media, we didn't need surveillance evidence in order to successfully defend this claim. And when someone says to me, well, how did you win it then? These are my 3 points. So first of all, the claimant's symptoms fell down on a detailed look. So she'd probably gone on the internet, like Jamie described, and had got all the basics of CRPS, but she fell down on the detail of onset. She fell down on the detail of the symptoms being intermittent. Secondly, we had 2 experts who were both prepared to say that these were self-inflicted wounds, and that was enough for us to make the assertion of fundamental dishonesty without having the social media or the surveillance evidence. And the third one, and I think this is one where we got quite lucky on, because normally there is a psychiatric fallback position in CRPS cases, but in this one, neither of the psychiatrists were offering a psychiatric explanation as a possible explanation for why the claimant was having these symptoms. So that's why we won on that CRPS case. Right, Jamie, over to you to go to brain injuries as our final faked catastrophic injury of the day.
Thank you, Zoe. So this part of the talk is to do with performance validity testing. And this is something that was historically referred to as effort testing. And in some of the authorities that Zoe is going to mention in a few moments' time, it appears in the judgments as that, as effort testing. You'll find performance validity testing in the context of a claimant who has normally suffered a moderate or severe traumatic brain injury. There is often observable brain damage or pathology on brain imaging, and the claimant will claim that as a result of that, they have ongoing impairment, normally cognitive impairment or behavioural impairment. And in a personal injury claim, with a claimant presenting like that, they will often be referred to a neuropsychologist for a report. And it is standard practice for a neuropsychologist to administer tests to check for the validity of the claimant's responses. And that is what PVT is. It's to validate the findings and really ask the question, is this really the limit to your capabilities? Is this genuine or is it not? There are a number of different tests that I'll come on to in a few moments' time, just to go through very briefly. These sorts of tests are not very, very sensitive. So as it says on the slide there, it means that individuals who are exaggerating or fabricating may pass some of them. And that's not to be unexpected because they're not very sensitive in terms of their applicability. But in contrast, people who are trying, giving a good effort, which is why it used to be referred to as effort testing, will normally pass them all. And I've got some examples here on the next slide. So neuropsychologists normally administer standalone performance validity tests, and there are some on the screen here. So the TOM test, for example, a claimant will be shown 50 drawings and then shown them again in pairs, and you have to say which one of the two drawings you've just seen, and you're told whether you're correct. It's quite an easy test, and the literature suggests that even people with quite serious cognitive impairment should be scoring around 45 out of 50. It's a well-liked test because it is largely insensitive to psychiatric conditions such as depression and anxiety. And as we'll come on to look at, that's often one of the excuses is, well, hang on, it doesn't take into account my psychological symptomology. There's the RDS, so this is the reliable digit span. This is there's a similar one, a digit memory test. Again, even in cases where claimants have severe cerebral dysfunction, you would expect someone to score somewhere in the region of 95%. And this is a test with numbers where you change the numbers and the patient has to identify which number has changed. There's also word memory test. Again, similar sort of thing, but with words. Again, it's quite easy. You'd expect someone to do quite well because there's often word associations. So, for example, a claimant may be shown the word pig and given a clue such as bacon. So these things are quite easy. And the basic point is they're tests that you would all generally expect somebody with even quite significant disability to do quite well in. And therefore, if the claimant is not doing quite well, that is a red flag that they may be deliberately underperforming because they want to demonstrate to the examiner that they've got a more severe injury than they genuinely have. So that's what, in a nutshell, performance validity testing is and how it is undertaken. As it says on the first bullet point there, they're designed to indicate a level of performance which is atypically poor. So it's not as good as you would generally expect. And that poor performance is not explained by the brain injury or the cognitive impairment or any psychological disorder. So that leaves one to think, well, if that's not the real reason for the low score, what is? And a low PVT score is consistent with a diagnosis of malingering, but it may not be exclusively consistent with that, but it's certainly a red flag to be aware of, particularly if a claimant is failing multiple PVTs, and that's why multiple of these tests are administered. As well as PVT and effort testing, as it used to be referred to, there's also a test or criteria for malingering that neuropsychologists can consider. Ultimately, of course, malingering, fraud, deception are matters for the court to decide. However, experts can assist the court, particularly with administering and interpreting PVT, and also by considering the Sherman criteria, which is the neuropsychological criteria for malingering. It's been used for over 20 years and it is accepted by most neuropsychologists. We'll go over onto the next slide and have a look at what the criteria consists of. But I suppose the point to be made here is, yes, you don't want your expert trespassing into the court's territory, but equally, if they can offer some assistance, then they should do, as long as they, of course, ultimately defer to the court to make those findings. The Sherman criteria, on the screen now, there are a number of criteria. Criterion A looks for the presence of an external incentive. And as it says on the screen, that will normally be fulfilled if someone is involved in litigation, because there's significant material gain from a successful personal injury claim. Although it doesn't always have to be gain, it could be the avoidance of an adverse event, such as this is sometimes seen in the criminal sphere, people who don't want to stand trial, for example, trying to be found unfit to plead or stand trial. Criterion B looks at invalid presentation. So we're really looking here for compelling inconsistencies which are indicative of deliberate exaggeration. An example may be, for example, a claimant who is observed doing something that they dispute. And you may have typically seen this in reports where it says, I observed the claimant through a window walking up the stairs on the way to the consultation, but once they were through the door, they presented very differently. That would be a clear example of the expert, the clinician, observing a disparity between when the claimant knows they're being examined and when the claimant does not think they're being examined or observed. Within criterion B, you may also have the presence of invalid PVT scores, which again, it says on the slide there, you'll be looking at evidence from those tests to see whether they are consistent and how many a claimant may have failed. There's then criterion C, which looks at marked discrepancies not observed by the expert themselves as part of the examination, but for example, discrepancies within the records, so the medical records. Sometimes an expert will comment, well, I looked at the GP records and there was an examination by the GP, which is inconsistent with what I am now seeing. Or that could involve discrepancies from social media reports or surveillance that may have been shown to the expert in the context of a personal injury claim. We're now going to look at some cases. Zoe, I'm going to hand back over to you.
Yeah, so unlike the first two topics, FND and CRPS, I'm not able to just pull out of the bag a nice example of a case where purely off the back of PVT failings, I've been able to secure a finding of fundamental dishonesty or a discontinuance. And to the best of my knowledge, there is no such case, but in a year's time, there may be, so watch this space. So in the meantime, what I'm going to show you is 4 cases that have considered relevance of PVT. So I'm going to tell you where I think arguably they went wrong in these cases. So the first one is Edwards and Martin. It's quite an old case now, 2010, because there's been a lot that's happened in terms of performance validity testing since then. But we had the defendant's neuropsychologist, Dr. Parker, basically using the equivalent of PVTs and forming the opinion that the claimant was consciously exaggerating his disability. The court preferred the evidence of Dr. Gadiali, claimant's neuropsychologist, who said that deliberate underperformance was an implausible explanation for 2 reasons. Firstly, because the claimant performed well on some tests, and some of the inconsistency arose from episodes of depression. Now, if you've been listening carefully to what Jamie has been talking about in the last 5 minutes, you will understand why that approach was wrong. So you quite often hear the claimant saying in cases where claimants have failed some but not all PVTs, oh, well, they only failed the defendant's PVTs. And the point there is that there is a real high bar to failing a PVT, and it's actually quite easy for claimants to pass PVTs and to still be deliberately underperforming. And that second point, that, oh, the inconsistency arose from episodes of depression, again, if you've been listening to Jamie, you'll understand the reason that that's wrong is because these tests are supposed to be sensitive to things like psychiatric injury. So an old case, and arguably one decided without full knowledge of what PVTs actually were. Right, Jamie, next slide. Martin and Salford Royal. So again, PVTs, claimant failed a number of the tests, including those two big standalone tests, the TOM and the RDS. However, in this case, it was opined that it was not unusual to be failing PVTs in cases of frontal lobe injury. So again, if you've been listening to Jamie, you might think, well, that's wrong because the tests are supposed to be sensitive to neurological injuries and the causes of the neurological injuries. The judge in that case did find that the neuropsychiatric testing had been undermined by poor effort scores, as they were then referred to. But the judge was more concerned with real life observations and thought that those were of greater evidential value than psychometric testing. So, good example of court going back to what it knows best, i.e. I'm the judge, I'll decide credibility. I don't really understand what this testing is and how it's supposed to show me whether someone is or is not exaggerating. Next slide, please, Jamie. So Pincus and direct line. So this is one you are probably familiar with, a case where the claimant developed PTSD with dissociative symptoms, over £850,000 in value. You had the defendant successfully defending the matter, court finding that the genuine injury was worth £4,500. Now, there is reference to PVT testing within this judgment because Dr. Kemp, who was the defendant's expert, the claimant failed the PVTs. Claimant's expert, who was Dr. Pierce, didn't actually bother carrying out any performance validity testing. And Dr. Kemp deferred to the court as to whether the PVTs were evidence of deliberate exaggeration. And there's reference within the judgment to that being the proper thing to do. So the judge went on to find that failing these effort tests is a reflection of the claimant's fabrication and or exaggeration. So again, although we have reference to performance validity testing, it really wasn't that an important part of the case. It wasn't the reason why the defendant succeeded in that case. It was almost viewed by the judge as a bit of an add-on at the end. Next slide, please, Jamie. And then the last one, Ali and Caton and MIB. This was a case where, again, defendant is relying on multiple PVT failures, including below chance failures on the TOM. And the defendant's expert just went out there and said, in his view, this was malingering. And he was really criticised, that was Dr. Walton, really criticised by the judge in that case for losing the objectivity essential for an expert. And one particular example was Dr. Walton doubting the claimant's medical records, which recorded that the claimant was hearing voices. So what the court said about PVTs in that case was this: the presence of reliable test results is useful, but not determinative. Their absence does not absolve clinicians or the court from reviewing all of the available evidence in order to form an opinion. So what I think is really important about this case is a lot of neuropsychologists will not go as far, no matter how many PVTs the claimant has failed, to say a claimant is deliberately exaggerating off the back of this kind of criticism. But my argument would be, and I think it's one of the final points Jamie's going to make in the next slide, is that if you do have evidence of PVT failures and you as an expert have considered all of the evidence in round, for example, by reference to the Sherman criteria, there is nothing to stop an expert, a neuropsychological expert, from forming an opinion to help the court on whether the claimant is exaggerating. So there is room for that case. And I think I'm going to hand over to Jamie now for the final lowdown on these PVT cases and what we can learn from them.
Yes, thank you, Zoe. Final slide of our presentation, and we've just put together some learning points from those cases in terms of PVT. So The first observation is if a claimant passes the testing, passes the PVT, and that's evidence in support of their claim. It demonstrates that they are putting in effort. It doesn't mean that they're not malingering, but it is evidence in support of their claim. And generally, for the reasons Zoe said, if a claimant fails PVT, that's not determinative, and many neuropsychological experts will not say, well, that is clear evidence of malingering, but it can be certainly seen as a red flag. And for us as lawyers, we should be looking for that red flag or that light flashing on the dashboard to say, well, hang on, something may not be as it seems in this case. Experts shouldn't be reliant on PVT. Back to Zoe's point, yes, you have to use it, but you have to evaluate all of the evidence in the round. It's no use saying, well, they failed the PVT, they're malingering, but equally, it does need to be taken into consideration and some analysis as to why that may be the case and an examination of other records. The court will take these testing results into consideration. They're becoming very commonplace, and the more cases that go before the courts with PVT, the more familiar judges will become to interpreting them and understanding what the arguments are. So basically, failed PVT can be evidence of exaggeration. If there is other evidence of exaggeration, then it can paint a picture, PVT as one part of it, which can be quite powerful. It's probably not enough on its own, but it is part of the jigsaw and part of the puzzle. And if experts are looking at PVT, looking at the case in the round, applying the Sherman criteria for malingering, and you're getting all three parts, then you may be in a situation where you look like you are on for a finding of fundamental dishonesty, or at least can present such sufficient risk of obtaining such a finding that, as with both of Zoe's cases, the claimant decides they don't want to run that risk, and you get the notice of discontinuance served upon you. That now completes our talk. So I'm going to now hand over to Brian McCluggage, who's going to give a talk entitled From Root to Branch, When Does Dishonesty Become Fundamental? As we know, not all misrepresentations by claimants are dishonest. That's the first point. And secondly, not all dishonesty is fundamental. So Brian's going to discuss how do we define fundamental dishonesty and how do we establish fundamental dishonesty, and take us through some of the cases in this area. So I'm going to stop sharing my screen and so that Brian can now present with his talk. Brian, over to you.
Thank you very much, Jamie and Zoe. And I hope that the front slide of my PowerPoint presentation is up on screen. And my talk is, I suppose, slightly different from the one you've heard. It's about standing back from the detail of the evidence to some extent and making sure that the fundamental dishonesty case that you wish to advance properly ticks the requisite legal principles. And the title of From Root to Branch is, of course, inspired by the language of the London Organising Committee of the Olympic Games and Sinfield, which we'll call LOCOG, which helped to confirm that what is fundamental goes to the root of the claim. But it isn't always clear what that means in practice. And here on the title slide of my talk, we have what I hope is an inspiring picture where we see the rotten and tangled roots of the compensation tree. But let's move to the essential principles of FD. I'm not going to go or run you through the wording of Section 57 of the Criminal Justice and Courts Act, because I anticipate that every viewer of this presentation will be familiar with that. But there are three vital components of proving FD to establish Section 57 and gain the benefit of the windfall that that provision allows. It is not simply enough to prove exaggeration. You have to identify what misrepresentations have been made. You have to prove dishonesty, the Iving and Genting casinos test. And while I'm sure that case, which isn't the subject of my talk today, is well known to all listening, if you don't know what it says, you shouldn't be running an FD case to begin with. And thirdly, what is the subject of today's presentation is the third point, that the dishonesty, of course, must be fundamental, but it is more than just a word that trips off the tongue when we're talking about Section 57 or disapplying quocs. It is a concept in itself. And yes, not every misrepresentation, not every dishonest misrepresentation is going to meet the threshold of what is fundamental. And it isn't always quite as easy to identify as one might suppose. And we're going to go through the key principles and case law, including more recent ones dealing expressly with this point, talk about a few practicalities that you might wish to check off in any case that you're running, and then we'll go to a case study based on an 8-day trial that was to start next Monday, but it has been carved up, frankly, because of the doubts as to the issue of fundamental. So the key principles are something that I don't need to stay with for very long. Everyone will know the Gosling and Halo case, 10 years old now, where His Honour Judge Maloney QC in the Cambridge County Court, in a case involving surveillance, drew a distinction between dishonesty affecting a collateral matter or some minor self-contained head of damage, contrasting that with dishonesty that went to the root of either the whole of his claim or a substantial part of his claim. Now, that was disapplication of quocs rather than Section 57, but the wording used, the test or overlay by His Honour Judge Maloney was endorsed by the Court of Appeal in Howlett and Davis, where Lord Justice Newey indeed described Judge Maloney's analysis as common sense. On a personal level, as a lawyer, anytime I hear the words common sense used in the legal concept, in a legal context, the hairs on the back of my neck stand up, because one man's common sense is another woman's foolishness. And I think it's a dangerous and simplistic way to look at these concepts. Then we come, of course, to Lowcock, and it's the most cited case in this area. You'll all know it. I won't dwell on it for too long. You'll know the facts. It was a left arm and wrist injury, and the claimant foolishly brought a fraudulent gardening claim. He already employed a gardener before the accident, but stated that it was a new need attributable to the accident, and he forged some invoices to boot. the gardening claim, worth about 14 grand, represented about 42% of the special damage claim. On the facts, probably a pretty straightforward case, but it was the analysis and the words used by Mr. Justice Knowles that mean that it's the starting point for the analysis of most trial judges, and should be for your own analysis when you're determining whether it is an FD case or whether to take it to trial. So the dishonesty must substantially affect the presentation of the case, and it could have an impact on either liability or quantum. We very often just focus on quantum, but if it affects liability, that may be just as important if it is in dispute. The judge talked about it needing or to potentially adversely affect the defendant, and said that it had to be judged in the context of the particular facts and circumstances of litigation. Now, I find, with respect, Mr. Justice Julian Knowles' exposition of this principle to be problematic. Far be it from me to challenge forms of words that have been now well discussed in other cases. But it is, as indeed more than one High Court judge had pointed out, a gloss on a statute. And indeed, even talking about the root or the heart or the core of a claim is a gloss on the statutory words of fundamental dishonesty. And we have an issue with judicial use of metaphor to explain a statutory test. And we start repeating these metaphors almost as a mantra as to whether dishonesty goes to the core. Well, the English word fundamental derives from the Latin noun fundamentum, which simply means foundation. And it concerns me whenever judges are invited to start thinking of roots and cores and hearts, when the actual word in the statute goes to foundation. And we can get into sterile debates at court in certain trials about what might be the difference between a root and a foundation. And it's unhelpful. I would much rather that the judiciary use something simple, that something that is fundamental is important to the claim. That would be a much more straightforward way to deal with it. Important or core, and that should be enough. So perhaps the words core and root are useful, but substantially affecting the case presentation just leads to uncertainty, unless insurers and defendants can use that perhaps to turn a more marginal case over towards the judicial evaluation in the defendant's favor. And we'll talk about how that might happen. I then move on beyond LOCOG to a few cases where whether dishonesty was fundamental lay at the core of the trial or the appeal. And Elgamal and Westminster City Council, which is a decision of Mr. Justice Jacobs sitting in the High Court deciding an appeal from the County Court, represents a crucial development in understanding what fundamental dishonesty looks like in a case of reasonably high value, and where the exaggeration and to some extent the dishonesty was plain. And the facts of the case were this. Mr. El-Gamal suffered a serious knee injury on a machine at the defendant's gym. And there was no dispute that he suffered a complex multi-ligamentous disruption to his left knee. He needed 5 surgeries in an attempt to reconstruct the ligaments. He was likely to develop osteoarthritis and need a total knee replacement in years to come. And this was to a 22-year-old man who was at peak physical fitness, in that he was a relatively well-known parkour participant, and also world ranked in the sport of free running. Of importance on the side, he was an aspiring stuntman. And that employment claim for loss of earnings ended up featuring prominently as to whether there had been FD. He presented to the experts as a man with a limp, that he struggled on public transport, including trains and planes, that he could not easily get in and out of a car, and that his knee was so weak that he could only walk for 20 minutes or a mile at max, and that he couldn't easily manage the stairs, even in his early 20s. Needless to say, there was surveillance of him, and it showed him to be doing rather better than he had said to the experts. The surveillance showed that he didn't limp. He could walk pretty freely. He could get in and out of vehicles without any issue at all, and go up and down stairs at will. Undoubtedly, there was misrepresentation through exaggeration of the true level of exaggeration of his symptomatology. His schedule of loss was £400,000 odd, with an agreed 35% contrib neg deduction. So the initial total before the surveillance was disclosed was only about 265,000. After the surveillance was disclosed, interestingly, we didn't see the usual picture of a claimant suddenly producing a vastly reduced schedule. Rather, there was an increased schedule of 735,000. The experts agreed, even after seeing the surveillance, that this was a significant injury. He wasn't going to be able to lift. He wasn't going to be able to kneel. He couldn't undertake energetic sporting activity. He could do light work. He could take public transport. He could use stairs normally. And it was run hard as an FD defence at first instance, and the judge at first instance, His Honour Judge Murdoch, dismissed the claim. And that was upheld by Mr. Justice Jacobs. And the main points were that the defendant, obviously sensing some difficulty, had tried to say that if the claimant had presented the case that they thought he would claim, where he was limping and couldn't take the stairs and the like, it would clearly be fundamentally dishonest. But as the claimant and the judge concluded, in fact, the lost earnings claim, which consisted largely of the lack of opportunity to work as a stuntman, would not work or would not succeed on the evidence, nothing to do with the way that the claimant had presented his symptomatology, but actually because there wasn't proper evidence before the court of the difference between a stuntman's earnings and the sedentary employment that this claimant was capable of, because he was a graduate as well as being very athletic. And there was no dispute that because of the knee injury, whether he could use stairs, whether he could get into a car easily or not, he was never going to work as a stuntman. He achieved a Smith and Manchester Award, but again, that was regardless of the exaggeration in the claim. And his PSLA award was £60,000 because he had suffered a significant injury. And of interest in the claim, the defendant had submitted that PSLA damages were worth only £12,000 in the case, a wholly unrealistic submission that in fact worked against the defendant. And one of the reasons that the judge at first instance found that the exaggeration wasn't fundamental to the case was because the PSLA was worth 4 times as much as the defendant's erroneous submission. And that perhaps is a good example of why presenting one's case in a measured and proportionate way is important. So another point that arises is that the judge criticized the defendant, this was Mr. Justice Jacobs, for treating the wording of LOCOG as if it was a statute. And he pointed out that there was a gloss. He concluded that this was more a case of incidental or collateral exaggeration or embroidery, as the judge put it. So we have to remember we need to prove how the dishonesty impacts specific heads of loss. And we will need to lay the groundwork through expert evidence of how the dishonesty affects quantum. The next case is called Denzel, and I was in this and I lost. I know usually these seminars are full of people crowing about their victories. I didn't do it at first instance. I was brought in for appeal to try to uphold what was a very good result for the defendant at first instance when we were clearly going to be vulnerable on appeal. It's not a catastrophic injury case, but the High Court judgment on appeal of Mr. Justice Friedman is a very useful one to read, and his reasoning will apply in catastrophic injury cases. And it was a minor road traffic claim, claimant alleging whiplash, but also bringing a substantial hire and storage claim, a full £50,000. The defendant's case was that this was a complete put-up job. The accident didn't happen, there was no vehicle damage, therefore no injury at all, and the whole lot should be dismissed. And at first instance, in front of a circuit judge local to Manchester, there was a curious set of findings. The judge found that the accident happened, found that the vehicle was damaged, and found that there was an entirely unimpeachable £50,000 hire and storage claim. Found that the pleaded whiplash claim, worth what would have been no more than £2 to £3 grand, just wasn't proven. But something else happened, which was that in the claimant's witness statement and when he was giving evidence at trial, according to the transcripts, he made mention that he'd banged his head on the window when he was shunted from behind, and that this led to pain and swelling and caused 2 to 3 days of symptoms. He never claimed damages for that, either in his particulars of claim, schedule of loss, or even in closing submissions for trial, but the honesty of it was challenged, which was inevitable given the accident was said never to have happened by the defendant. And the judge found that that one aspect of the claim was dishonest, but also fundamental. And the wording that was used was that, well, he made a claim of head injury. It was dishonest, therefore it was axiomatically fundamental, and he dismissed the entire case, including the £50,000 hire claim, which, needless to say, had the storage company and hirers behind the scenes enraged. The claimant appealed. Insurers were unsurprisingly not keen to let go what was a very good result. So we went in front of Mr. Justice Friedman, a commercial silk, now a commercial judge, who got to explore the wonderful world of £50,000 credit hires claims and £2,000 whiplash, which was a voyage of discovery for him. But we had a very pleasant day in court. He decided that it could not sensibly be said that what would have been at most a £300 bang to the head was fundamental, but particularly so when the claimant never claimed for it. It wasn't part of his pleaded case. It didn't affect the presentation of the other injuries, which were themselves minor. I recognized the potential weakness of our case and tried to point out that the judge shouldn't look at value. I tried to tie it in to the other aspects of the case, because, of course, the head injury, particularly if it led to bruising and swelling, was a detail, an important one, that would have supported the claimant's case on liability. It would have supported the claimant's case that he suffered a whiplash injury. And one had to take that element of the claim outside of its very narrow remit of symptomatology and value and see how it affected the claim as a whole, introducing Mr. Justice Knowles' Lowcock arguments that it would affect the defendant's position significantly. Unfortunately, the judge was not prepared to buy that submission and just dealt with it shortly and sharply after going through all the authorities to say that it was completely wrong of the judge to use the wording that because this one small detail of the case was dishonest, that it was necessarily axiomatic. And in reality, which I had to concede at one point, the judge's reasoning was a tautology. He effectively said that all dishonesty was fundamental, and that was plainly wrong and a misapplication of Section 57. So we need to look at pleadings. We do need to consider proportionality, and we have to make sure that the dishonesty goes to a claim that is brought. Where we did get somewhere in Denzel was on cost penalties and cost sanction. And that was a case where, frankly, arguing costs through 44.12 was a more, or 44.3, 44.2 was a more productive solution to the problem. I then refer to this case of Cullen very briefly. I was in two minds whether to cite it for the purpose of this talk, because it's not a case where the trial judge dealt with an issue of what is fundamental. But I think some of the issues of what is fundamental arise. And I would strongly encourage all of you who work in this field to look at this lengthy decision. It may be as useful in reminding us how making allegations of dishonesty in the wrong case is probably counterproductive. It was a clinical negligence case, and there was admitted clinical negligence for a delayed diagnosis of laryngeal cancer. It's quantum in dispute. And the claimant had much more extensive treatment than would otherwise have been required, and there was no dispute that she had what's called a total laryngectomy. Forgive me if my pronunciation is not correct. She breathed through a stoma in her neck, and she spoke via a valve located in the wall between her trachea and esophagus. And that featured prominently in paragraph 1 of the trial judge's decision. And those who practice regularly in this field might think it worth being cautious about how one alleges fundamental dishonesty against such a claimant. And there was what some claimant practitioners have described as a scattergun approach, where every fact in dispute ended up becoming an allegation of dishonesty. And the judge emphasized at one point that the defendant had put a Part 18 request with no fewer than 189 questions to this severely injured, severely disabled claimant. And although the judge was very careful not to criticize the defendant's legal team openly within his judgment, it is apparent that he was unhappy with the defendant's presentation. Now, I am not here to criticize how it was done, because of course how a case reads in a judgment might be very different from how it looks behind the scenes in some ways. We do not know, for example, whether the defendant, who was an individual surgeon or doctor, whether the defendant was uninsured and therefore bound to take every point that she could in a £2 million catastrophic clinical negligence claim. But it's where it can all go wrong. And there was surveillance, there was social media, there was cross-examination on all of these. And the allegations, I suppose, were ultimately fundamentally about whether a 1.3 million future care claim could be disputed. In the end, 1.5 million was awarded. 1.3 million of that related to future care, but there were fundamental dishonesty allegations about a stair lift. And that's the example I'm going to use now. It's a question of law, and it may be a question of professional judgment as to whether you raise it at all. The stair lift allegation was an isolated example of where fundamental dishonesty was alleged. And in the context of this multi-million pound claim, it was said that a stairlift claim of £16,000, including servicing, was dishonest, because it was said that the claimant could use stairs perfectly well. Now, a treating OT had recommended a stairlift. The experts who dealt with breathing and lung capacity accepted that there was some breathlessness on the stairs, that she did, through her disability, have some problem, but she could recover quickly from that. Ultimately, the physiotherapy experts agreed there was some difficulty, but it wasn't sufficient to justify a stairlift, and the claim was removed from the schedule of loss before trial in reliance of the statement or the representation by the physiotherapy experts in their joint statement. Dishonesty was maintained to trial, and the judge roundly rejected that. And I suppose I sit back and I think, well, was it really worth pursuing an allegation of fundamental dishonesty over a stair lift when the issue was not, as a matter of fact, whether she used the stairs or not, but rather, as I put as a bullet point on the slide, it was an evaluative question, interpretive, as to whether she needed a stair lift. And I would respectfully suggest that if anybody is ever going to allege FD, evaluative and interpretive questions, one has to be very careful, because it may be very difficult to argue that any exaggeration relating to that or any dispute as to that is fundamental to the claim. So some practical points. We need to look at the nature of the dishonesty, of the misrepresentations alleged. What's the nature of the conduct? What's its timing and duration? That's going to go to what is fundamental, what is important. Are they active misrepresentations, or is it just by omission? It's obviously easier to show that dishonesty is serious if it is an active, positive misrepresentation. Is it evaluative or factual, as I've just mentioned? How does it relate to the claim? What's in the pleading? If it's not pleaded now, is it likely to be? And is that enough? Do you want to wait till you see what is in a witness statement or what is in a schedule? I would submit that timing is usually critical to alleging FD. Many defendants, many insurers, quite understandably, want to allege FD, show your hand, get the surveillance out as quick as possible. It's not always the best step when you need to really see how the claimant puts their case to be sure it's fundamental. Timing is critical to whether something is fundamental, because otherwise the claimant will trim his or her sails. What's the impact? What's the proportion of the claim to be affected? I've already mentioned Lowcock, it was 43%. Suppose, as in the laryngectomy case I've mentioned a moment ago, it's 1%, because that's what it was. 5%, 10%. There's probably an unwritten minimum threshold. How does it affect the case presentation? How does it affect settlement approach? Because you may be able to tie these in with the Lowcock approach of whether the dishonesty significantly affects your interests. If you're paying lots of money or more money to defend, if you've got to reserve more, if your costs are much higher. Those are things to take into account. Are you going to need evidence? What evidence are you going to need? You're going to need expert evidence that deals with the impact of the dishonesty on the earnings claim, on the care claim. It's not enough for the experts just to say, it seems more than I would expect from this type of injury. You might need, and I see this almost never done, as to how the dishonesty has affected the insurers on the claims handling process, on the reserve, on the fact the case may have settled long before. That's what solicitors could deal with the costs implications, all potentially important. And then I put it very quickly into a case study. So this is similar to the facts of a case, as I say, that I was going to run to trial next week. And here, what is interesting is that the claimant benefited by putting his case extremely modestly. And I think deliberately so, because behind the scenes, claimant solicitors and counsel were suspicious of him. It was a motorcycle accident. He said in a pre-lit witness statement, and to his orthopedic surgeon served with the claim that he couldn't walk more than 300 meters. He always needed a walking aid, like a crutch outside. He could no longer pursue his hobby of dirt bike racing, and he'd never ride a motorcycle again. He'd lost his social circle. He'd barely go out his front door. Now, he had suffered, undoubtedly, very serious injuries, multiple serious orthopedic injuries. He had a hip replacement by his mid-30s, which was going to need a revision. Very bad ligamentous injuries to his knee, and indeed nerve injury that meant he had a modest drop foot and was going to need orthotics. Also had an injury to his arm. But the surveillance showed he was walking outside without a stick. He had a limp. He wasn't riding a motorcycle, but he was riding a Vespa scooter, even though he had a car for Motability in any event. The social media evidence, and there was a lot of it, showed him attending dirt bike rallies all over the country. No pictures, unfortunately, showing he was racing, but he was plainly doing a bit of mechanics on his mates' bikes in the field and going to parties afterwards. Even some photographs showing him sitting on the dirt bike. The claim is issued with a very provisional schedule of loss, incomplete, and FD is pleaded. Now, I've modified the facts here quite deliberately to make it more interesting, but that's broadly analogous to what it was. And it seems like an obvious fraud because he'd lied through his hat about not just that, his lifestyle, his degree of disability, whether he could travel by motorcycle, but his care claim was presented so modestly that we had some difficulties. He claimed for quite a modest, gratuitous care claim. There were no carers, no commercial element to it, and there was none pleaded for the future. On the way he presented to the experts and in his statement, one would think that he could never work again. But his schedule of loss said he had residual earning capacity, albeit in sedentary work, possibly only part-time, but only time would tell. Yes, he lied about whether he could ride a moped, but is that a lie? He said he couldn't ride a motorcycle, so there was an argument as to whether there was a distinction. And in any event, the claimant's argument was going to be, why does it make a difference whether he can ride a moped or even a motorcycle to the way in which he put his claim? Now, the reality was that one of the points in his claim, he was seeking single level accommodation. And we argued that his general social and lifestyle activities were going to affect how he would, how the extent to which he'd be disadvantaged on the open labour market, and also very much as he aged, whether he would need single level accommodation. But it was a marginal case where his credibility was severely affected, but that wasn't necessarily going to be enough. So one practical aspect in that case, as arises in many FD cases, is that actually you're better off having a claimant who really does go to town on his injuries and his claim. That's why it's so important to keep the claimants off guard until they've gone for the grossly exaggerated account in their witness statement, and after they've seen the doctors and gone to town. So the other point there was with the experts, the defendant's experts had sort of seen through his exaggerated presentation. They said, well, he should be doing much better than this now. They had, through supplemental letters, to say, well, we saw through his exaggerated account, but had we taken it at face value, then our opinion would have been different. We would have said that he would never have worked again, that he would need single level accommodation, that he would need a significant care regime. We still had the disadvantage that he hadn't claimed for those and never had, but we were tying it in again with how he presented it, what we might have settled the case for, and what still would have made a difference to a few £100,000 of the claim. Ultimately, the FD was validly made, but it was a negotiating tool and a claim pitched at 1.5 million, which likely had a true value of about 600,000 plus £500,000 costs, was settled at a global sum of £350,000. So a very good deal. Right, I'm going to come to an end there. There is a handout to go with my talk, 15 pages. That'll be sent to those of you who are attending, and hopefully that will help fill in the gaps. And we're now going to be moving to Chris Kennedy, who is going to talk, unlike me, about a triumph of his advocacy, where he's won the extremely important case of Shaw and Wild in the High Court, with the many lessons that flow from that. Thank you very much, Chris. Please take over.
Thanks, Brian. And the first thing I shall do is to try and share my slides. I'd have a drink of water, actually. As Brian said, I'm just going to talk to you for about half an hour or so about the lessons I learned from a case I did earlier on this year, leading Matthew Snar, also from 9 St John Street, a case called Shaw and Wild. What we need to tell you about it? Well, in line with Brian's warning that there should be little or no crowing about what happened, I've restricted myself to one slide of congratulation. This was a case of fundamental dishonesty. It resulted in a claim valued by the judge at 1.2 million being dismissed completely. That makes it the highest FD case, both in terms of the amount claimed and its ultimate judicial valuation that has been before the court. It secured some very favourable press coverage for the insurers. However, that is not what this half an hour is about. This talk is about the lessons from Shaw and Wild. To tell you a little bit about the lessons, I'm going to have to tell you a little bit about the story itself. So it started with an accident on the 30th of June 2018 when Mrs. Wild emerged into the path of Mr. Shaw. He was riding an unlicensed, unroadworthy motorbike, but nonetheless he was on the major road. Primary liability was admitted, and there were some allegations made of contributory negligence, to which I will return in a moment or two. There was also no doubt that this was a serious injury. That is, Mr. Shaw injured all 4 of his limbs. To give you some idea of the kind of case we're dealing with, he underwent 23 separate procedures. Worst off were his left wrist, which, as far as I can remember, was dangling by a few sinews immediately after the accident, and his right femur, which was, well, probably messed up. So it's the kind of case where it wouldn't surprise you to find out that before the proceedings there'd been 150,000 made by way of interim payments, and that was indeed the case. That was the situation as things stood in July 2019, when the case was indeed issued. And the events which interest us started in March 2020, when a schedule was produced which valued the claim at £6.5 million before any allowance was made for aids and equipment. That was followed a few months later by a request for £1.5 million in interims to pay for rehab, accommodation and the vehicles that the claimant was interested in. Well, by the time the interim payment came round, there was some video footage. It showed the claimant clearly limping, but able to walk a total of about 900 metres to his local shop without a stick. That was to be contrasted with what it historically said, which was that he could walk 200 metres with a stick. On that basis, the defendant said, no, you can't have your £1.5 million. They weren't then faced with an application in that sum. Instead, the claimant applied in November 2020 for £300,000, a much lower sum. Key assertions he made was couldn't do much walking, he needed a mobility scooter to get out and about, and a quad bike to observe his friends undertaking their pre-accident activities, which in his case prominently featured base jumping, with which you may or may not be familiar. That is jumping from buildings and analogous objects which are not very high above the ground, and opening a parachute. And yes, it's all right for some. What happened in relation to this case was further surveillance, 2 rounds in 2020. In July, he was seen on an e-bike going to the shops, picking up groceries and nappies. He had care of a small child, putting them in his backpack and riding home at some speed, the kind of speed that meant that the surveillance operatives couldn't keep up with him. That could be contrasted to his assertion that he relied on a mobility scooter to get out and about. Then in November 2020, there was a longer period of surveillance. He was driving a white Land Rover Discovery. He put 2 mountain bikes on a rack. He pumped up the tyres of the bikes, went with a friend to a rural location. He had his large dogs in tow, and he had a big holdall on his shoulder. He rode off away from the camera, was gone for about 90 minutes before he came back and put his bike back on the rack again. So there was a bit of a dilemma. On the one hand, there could be absolutely no doubt that this was a genuine and serious injury. But stepping back, it just wasn't the kind of case that the defendant insurers were being presented with. In order to develop that further, I want not to take you through the entirety of the statutory regime for fundamental dishonesty, but to focus on 2 parts, the parts I've put in red on this slide and on the slide that you're about to see. The first proposition that was important in this context is the requirement that fundamental dishonesty must be personal to the claimant, not his solicitors, his case manager, his mum, his dad, etc. And the second one, which you'll see on this one, is that there is an argument that if the consequences of fundamental dishonesty are seen to be substantially unjust, then that may provide an exception to the rule that the claim must be dismissed. And those are 2 matters that were explored in Shaw and Wild, and which I want to look at with you today. So going back to the position of the insurers faced with this surveillance, but with this very large interim payment claim, they came to consult me and my instructing solicitor, and we were acutely aware of this personal requirement, that the dishonesty must be personal, and also that the footage wasn't all one way. He had been subject to surveillance on 16 days. The surveillance only captured him on 8 of those days. He clearly limped. The evidence that we relied on in terms of contradictions was clearly historic. On the other hand, he did not know what we had seen him doing. So we came up with a plan, and that's lesson 1. We wrote him an email, or my solicitors wrote his solicitors an email, saying, and you can see it there, we have evidence your statements in support of the application for the interim payment are misleading, inviting him to correct them and withdraw the application. And our reasoning was that this was a win-win situation. Either he does exactly what we invite him to do, and that opens the door for a realistic conversation about how much the case is actually worth, or he doesn't do that, and FD comes into play. Well, I wouldn't be talking to you about this case if he'd taken option 1. He took option 2 and maintained his denial that he had put forward a misleading picture. So the surveillance was disclosed, the interim payment was denied, and the particulars were amended to plead fundamental dishonesty. And that had consequences. He didn't get his further interim payment. There's no denying that that caused him hardship. He sought to challenge that decision. It was a decision of Mr. Justice Turner, and he tried to appeal it but didn't get permission. And the email continued to play a role in the case. I put on this slide a paragraph from the judgment, paragraph 174. I don't need to read it to you, but I've underlined the last bit because that encapsulates the proposition. Mr. Shaw had an opportunity to come clean. He chose not to set the record straight, and that weighed very heavily with the judge. So the first lesson was that this was a strategy that worked. I'm going to move on to something that was a bit messy, and that is clearing the decks, as I've called it. We had, in this particular case, some arguments of contributory negligence, which frankly weren't great, but if you had nothing else, which at the time we didn't, were worth putting out there to see if they produced a discount. Once we had fundamental dishonesty, they ceased to be quite so attractive, and our priority was trying to get out of the liability trial. The long and the short of that is we didn't succeed because it became a question of who was going to pay the costs of the liability trial and inquiries. And ultimately, we ended up running a liability trial, which we lost, albeit the issue of costs was deferred to the end of the FD hearing. At the end of the FD hearing, 2 competing visions were presented to the judge. We said, well, if this had all been done together, you'd simply have dismissed it all and the statutory consequences would follow and we should have our costs. The other side said, no, this is a discrete issue. There's Court of Appeal jurisprudence in the case of McKeown and Langer. You make them pay for the costs of liability. And broadly speaking, that is what the judge did, although he did allow us to set off the interim payment. So it was pretty much a cost neutral result. The reason we had this difficulty is that Part 36 doesn't help in this case, because if you accept a Part 36 offer, that carries with it an entitlement to costs unless it's unjust to do so. And there's no guarantee that a judge will decide that because you've got an FD allegation, it is unjust not to follow the consequences of Part 36. In retrospect, what we'd try again if we were, sorry, I'm going back to that. In retrospect, what we would try again if we were in this situation would be to go down the cul-de-sac route and see if that did any better for us. But that is a lesson that I put before you. Be aware that it's not as easy as you think to clear the decks, as I put it. Third thing that I want to talk to you about is how to meet the it wasn't my fault, it was somebody else's fault. It was my solicitor's fault that all these exaggerated things were said. I listened to what my care expert said. I listened to what my case manager said. This is all things that my brother or my wife, which was one of Brian's examples, said I should be doing. This is something that came up quite significantly in our case, and this is how it went. We relied on 4 areas of dishonesty, focusing on the May 2020 schedule. That the claimant had understated the extent of his mobility. He wasn't dependent on a scooter. He was perfectly capable of riding electric mountain bikes. That he had overstated his reasonable needs for support and for transport. That what he'd said about holidays just didn't belong to the real world. He'd said he needed first-class travel and a companion to go with him wherever he went. In fact, we got his travel records, and he certainly didn't need that. He was a much-travelled individual without that kind of support. And that he said he couldn't manage stairs, we said he could. Well, Mr. Shaw offered a sort of portmanteau defence, a bit of, I'm not very literate, I made some mistakes, I checked things over quickly, a bit of, I relied on advice from my care expert, where there was a problem with that. He hadn't met his care expert at the particular time when he relied on her advice. And I told my solicitors. So we had a number of strategies to meet those particular issues. Excuse me a moment. Yeah. The first thing was to focus on the statement of truth in his schedule and in his witness statements, but most particularly in his schedule. And that hit home. And you can see that from the paragraph I've quoted from the judgment, paragraphs 170 to 171, where the judge said, I've considered the submission that Mr. Shaw did not realise he was advancing exorbitant claims because he simply relied on his experts and his lawyers. I reject this submission. The first reason is that Mr. Shaw verified the schedule of loss and a subsequent witness statement with a statement of truth. In my view, the statement of truth indicates that the person verifying a document knows what they're saying and vouches for its accuracy. Now, that didn't come from nowhere. That came from a line of cross-examination that we pursued. So I think about 3/4 of an hour at the beginning of Mr. Shaw's cross-examination was all about statements of truth and that you own what you sign. So you've got helpful judicial assistance, but also once he gets to the witness box, he's faced with a terrible dilemma. He's already confirmed his witness statement. It's impossible for him to resile from it. And therefore you can, through cross-examination, quite easily put a claimant like Mr. Shaw in quite a difficult position. There are a number of other strategies that we adopted. The first is, he having said, I relied on my solicitor's advice, we said, well, you've waived privilege in your solicitor's advice. Show us your notes. And providing you don't make an application and lose it, that's a win-win. Because either he shows the notes, which in this case he did, and they don't say, I consulted my solicitor about what I should say, which in this case they didn't, or he doesn't show the notes and you invite an inference, say, well, we asked him for the notes, he hasn't backed it up. So that was a second line of attack, which was useful. The third one is you've got some real help from the judge here, going further than some other judges in other cases have done, in that he had a report from his care expert, who was the well-known care expert Maggie Sargent in this case, who had, on the basis of his history, advised that he required 10 hours of care a day in the initial period of his recovery. And the judge found that he had an obligation to look at that and satisfy himself that that was true, because he said a moment's reflection about that evidence should have led Mr. Shaw to realise he had not received anything like that amount of care, as the judge said, at a time when he was fit enough to travel to Croatia and Italy with his base jumping friends. Yes, that was part of the evidence as well. So you have a number of recourses open to you, which I advise you to look at and explore if you find yourselves in a similar situation. And that is taking me to the final point, which is perhaps the most interesting point, or the most interesting lesson in relation to where the law in fundamental dishonesty currently lies. And that is, we're still not sure what substantial injustice means. We know it's more than the mere fact that damages will be lost, but we don't know how much more or what. And a particular reason for that is that we now have two cases, our case, Shaw, and a case of Mr. Justice Ritchie's at the same time, or around the same time, Williams Henry, which give certainly differing indications as to what the situation might be. And if I may, I'm going to start with the Shaw analysis and then move on to the Williams Henry. So in Shaw, when the judge asked me, well, wouldn't there be substantial injustice in this case if Mr. Shaw was deprived of his damages? I said, well, no, he would simply be in the same position as any other person who didn't have a solvent tortfeasor to sue. And the judge accepted that. He also accepted that you need to take account of the blameworthiness and effect of a claimant's conduct. Here, Mr. Shaw had lied and continued to lie. He was unrepentant. In fact, Mr. Shaw was a gambler in terms of he as his hobby of base jumping might suggest, he was not averse to risk. That came out during the course of his evidence. And the judge found that his lies had added to the corrosive effect of cases like this on honest claimants. In fact, he specifically said he was a gambler as well. I see that from my slide. Rather than admit his errors, he gambled that his lies would not be found out or the court would excuse them. That's a very good description of what he was like in evidence. He was intelligent, always had an answer. And the judge accepted that the dismissal of the claim was going to cause him significant financial hardship, but he found that he only had himself to blame. Compare that to Williams Henry. That was a similar case, perhaps not quite as much at stake. It was pleaded at £3.5 million and the genuine valuation was 895,000. But you see similar lies about the injury, about hearing loss, walking, couldn't stand noise, etc., etc. You can see them on the slide. You also had similar collateral dishonesty. So both cases featured lies to the DWP. And in Williams Henry, they also had lying on a life insurance application. So two findings of fundamental dishonesty. But what Mr. Justice Ritchie decided was that there was a more structured approach that should be adopted to the question of injustice. You start with the proposition that this section started with. It's not enough for it to be substantially unjust if all you do is you lose your damages, because that's the penalty that Parliament intended. But he said, it's not like a heffalump. You don't know it when you see it. It's got to be more predictable than that. And he split the two propositions. So there's injustice and it has to be substantial. And then he said, well, here are some factors. Look at the amount claimed as against the amount awarded. If the damages in fact gets as small compared to the amount awarded, then that favours substantial injustice. Look at the scope and depth of this dishonesty. There is authority, I think it's Roberts, that you judge dishonesty at the time when the dishonest representation is made. But Ritchie is saying that for the purpose of looking at whether this substantial injustice exception applies, you look at how long it was persisted with, how bad it was, how deep the dishonesty was. And you look at the effect on the claim, how much work was done that would otherwise not have been needed. And it's reasonable for a defendant to say, well, if the claimant had not been dishonest, we would have settled this case. And that may be quite a useful argument, because the costs of running a case like this to trial are significant. So Ritchie also said, you look at the level of disability, how much of a burden are you transferring to the taxpayer? A direct contrast to the analogy that Judge Sefton accepted, which was, well, if you have somebody without a tortfeasor to sue, they would be in the same situation. You look at the nature of the tort, there were some quite difficult issues with regard to the tort in the Williams Henry case. Not so much in our case, or in the example given in the Williams-Henry case of, particularly bad driving, sexual abuse, etc. Ours was a straightforward road traffic case. And you consider what would happen with regard to costs, because the costs are going to be awarded anyway. Is it going to be worth the candle for the claimant? Is he going to get any money at the end of it? If he's not going to get much, then there's not much that he's being deprived of, and that is relevant to substantial injustice. Other factors, and you can see it's getting to be quite a long list here. Interim payments, will he be able to repay them? What effect will the dismissal have on the claimant's life? Will he lose his home? Will he be unable to work? Will he need benefits? In the end, however, Mr. Justice Ritchie decided in the Williams-Henry case as well that there would not be substantial injustice if he was deprived of his remedy. In both cases, for different reasons, the claimant didn't have to repay the interim payment, and that's worth remembering. We used it as a set-off against costs. They waived their right to get it back in Williams-Henry. Again, it was significant for both Mr. Justice Ritchie and His Honour Judge Sefton that there was a persistent cause of dishonesty pursued to trial. So you get some themes and some contrasts. You get the loss of damages not being enough, but the effect of losing the damages is potentially relevant. You get the issue of the interim payment. You get the issue of consideration of cost consequences and of what the wider effect will be on the claimant. And you get the issue of persistence as being potentially relevant. So they are different in approach. There does, in my view, need to be further judicial scrutiny of this, and at a higher level, to reconcile the approaches. Either that, or there needs to be a further line of cases to develop one or the other. So we need to wait and watch this space. But there are two particular scenarios that occurred to me as interesting scenarios in relation to the jurisprudence on substantial injustice as we now have it. The first of these is supposing that you have a claimant like Mr. Shaw who'd tried it on, perhaps tried it on for 6 months in 2020. And then he says, okay, it's a fair cop, I agree. Does that mean that he is less likely to lose his damages because the substantial injustice exception might apply? Well, that appears to be part of the Ritchie reasoning, certainly in Williams-Henry. The second one, which was an example that I had in my back pocket, if the judge had asked me, well, what is substantial injustice? When can it apply? If it doesn't apply in this case with such a seriously injured claimant. And the scenario I had in mind was, if you have a road traffic accident in which 2 people are injured, one of them very seriously and one of them not so seriously, hardly at all, and the one who was injured very seriously gives dishonest evidence to assist his fellow claimant, maybe it's his brother or another family member, perhaps having been put under pressure by that person to support their claim. That would be fundamental dishonesty within the terms of the Act. But you could also see yourself coming to the conclusion that it would be substantially unjust for the seriously injured claimant to lose his damages because of attempting, albeit dishonestly, to assist a potential claimant. So I put those before you as potential scenarios which may either assist or give rise to further thought. And I leave you with one final thought, which is how expensive this all is. Shaw and Wild involved a 2-week trial. 50% of it was taken up with the experts. The whole of week 2 was devoted to the experts. In relation to the statutory scheme, the whole purpose of calling the experts was simply to see if the claimant would have to pay any costs if there was a finding of FD. In the end, of course, he had no money to pay any costs. So on one analysis, the whole of week 2 and all the medical expert evidence was a waste from the defendant's point of view. They could simply have said, well, we're not going to enforce any order for costs anyway. You don't need all that. We'll simply rely on the lay evidence. If only life were that simple. The fact is that a lot of evidence came out through having the doctors, and the doctors themselves listened to the claimant give evidence and were very persuasive in their abandonment of it. So that is not the simple solution it might at first appeared, because we didn't lose, we wouldn't have gained any money from the claimant from that the whole of that second will, because he never had any money to pay costs anyway. We did get some good evidence out of it. So it's a balance. It's something to think about, but it's a balance in each particular case. Well, for those of you who have sat through the whole of this podcast, thank you very much for your patience. It's been very interesting. I've learned a lot from listening to Zoe, Jamie and Brian, and I hope you have too. Thank you very much for listening.